Some faith-based organizations are stepping in to help address social ills where there are possible gaps. Churches have embarked on training their members on basic counselling services, and these are targeting communities and individuals at various health institutions. Today, the faith-based organizations will be hosting the first National Medical and Community Conference in Bronkhorstspruit outside Pretoria. And Zinoko Mhlaba is standing by to tell us exactly how this will work. Good morning, Zinoko.
A very good morning to you, Yes, we're here in the north of Tshwane in Bronkhorstspruit. That's where you find faith-based organizations gathered here to launch what they call the first Medical and Chaplains National Conference. So apparently the group of faith-based organizations have been embarking on a project to train some of their members to ensure that they are able to provide essential services, especially in relation to counseling matters to their members, so that they can be able to assist in various communities, especially healthcare facilities. But just to give us a sense of the background of this project and how it got to where it is today, I'm joined by Mr. Tami Mbabo. Dara, thank you very much for your time. It's a very, very important day for your initiative for the faith-based organization. But just before we get to where we are today, tell us about what inspired this project. How did it come about?
We started this project 3 years ago. After realizing that there is a need for spiritual intervention in the lives of our communities. And we decided to embark on the training of religious leaders at first, but we became inclusive because we are an interfaith movement. What we then embarked upon was a program of going province by province and training chaplains, because we saw a need. During the period of COVID, that's when we also realized that this program had to be broadened and it had to reach out even to the periphery of our country. And we were not sponsored even by government. We were working independently, but fortunate enough, the Department of Health, the Department of Justice and Correctional Services, they then bought into the concept and supported our programs. Until now, we are still not funded by any government institution. We did this independently because what we impressed upon people is that people, when they take initiatives, they should not always depend on the state and support of the state in terms of resources.
Sorry to cut you, sir. Sorry to cut you there. I understand you have to go in quickly. But can you tell us more about the contents of the program? What are you training these individuals on specifically, and how long does the program take?
Specifically, we train them on palliative care. We train them on spirituality. We train them on counseling. And we also give them skills on how to deal with communities across their faiths without necessarily relying on your faith or your belief system alone. Part of it, we are training them on different religious belief systems. So that's what it entails.
I mean, talk to us about the response from the community. One will maybe say some people who maybe have different religious belief might be skeptical to access or to accept these services. So how have the engagement been, and how has the reception been from community members, especially those who are not entirely of the same belief as some of the members of the organization that you're talking about?
Yes, the fortunate part is that because we were open from the beginning, we were not concentrating on one faith. Our approach was interfaith. Now, we use the system that is called referral. When a person has a belief, for example, if a person believes in a particular religion, we recommend a chaplain who actually belongs to that religion to be the one who must deal with that person. In that manner, you avoid or you some sort make people to understand that we are at the service of all God's people without any form of discrimination.
All right. The relations from, I understand this is a medical and chaplains conference. Talk to us about that relation. How relatable are these concepts? And as far as the service that you're providing or you're training these members on, how are they related? Do they interact at any point?
Yes. We will recall that the World Health Organization, initially when they were defining what a healthy person is, they will talk about a person being healthy physically, a person being healthy in terms of social support, a person being healthy in terms of economic standing, and then a person who they were trying to capture the physical part of a human being. But how we came into being is that there was a debate about the matter of the spirituality. So this is where we come in, because people in particular who are in a palliative state, sometimes they don't need medicine for them to be okay or to feel better. They need spiritual intervention. And this is how we actually married the two. And I think even most of our medical people today, they have actually changed their thought about matters of spirituality. So this is how we come in and marry the two.
Thank you very much, Mr. Mhlaba.
Thank you, Tami.
Mr. Tami Mvami, one of the people responsible for overseeing this project, explaining to us the relation between faith and spirituality, especially when it comes to addressing some of the challenges faced by members of the community. So we'll try to speak to some of these trainees or the graduates themselves, but also talk to community leaders themselves so that they can make sense of this partnership. But also later on, we'll try to give historic context of these relations between politics, religion and government, especially when it comes to addressing essential problems faced by members of the community to do that.
Zinoko Mhlaba, thank you.